Welcome to another episode of our podcast series. Here we'll talk about sexual and reproductive health and rights, SRHR, for people with disabilities in Pakistan. In this episode, we'll discuss the importance of inclusive SRHR. I'm your host Arham, and today we have a special guest, Mohsin, a disability rights activist. Welcome to the show.
Thank you so much for having me. As a person with a disability, I've faced many challenges in getting reproductive health services and information. Many healthcare workers don't understand the unique needs of people with disabilities.
Can you tell us about your work in the disability rights movement and why SRHR is so important?
Sure. As a deaf youth, I've faced barriers in getting essential health information and services. Unfortunately, there is a common misconception that people with disabilities don't need the same health services as others. My work focuses on raising awareness about the importance of inclusive and accessible health services that respect our rights and dignity.
That's so important. Can you share a personal experience that shows some of the barriers?
Once I went to a health clinic to ask about reproductive health issues, but there was no sign language interpreter, and the staff didn't even write things down to help me understand. I felt ignored, neglected, and disrespected.
That's sad. Can you tell us what are some of the major challenges you see when it comes to accessing health services?
A big challenge is the lack of accessible information and inclusive services. This could be physical barriers like examination rooms that aren't wheelchair friendly or communication barriers due to the absence of interpreters. Without proper resources and understanding from healthcare providers, it becomes incredibly difficult for us to get the help we need.
Now, can you explain what SRHR includes?
It includes several components, such as health education, ending gender based violence, safe pregnancies, protection from violence, and more. It's about making sure everyone can access accurate information and health services without facing discrimination or exclusion.
Are there SRHR topics that are often ignored for people with disabilities?
Yes, topics like menstruation, family planning, and reproductive and health education are often not made for people with disabilities. Some people wrongly think we don't need this information, which is not true.
Do these wrong ideas come from society, doctors, or families?
Sadly, these wrong ideas come from all three: families, doctors, and society. Families sometimes overprotect us and avoid talking about important topics like relationships or health. Some doctors think we don't need reproductive health services because they assume we won't face those kinds of health issues. And society also forgets our needs when planning health programs, like not providing interpreters or making clinics accessible. This leaves us out, even though we have the same rights as everyone else.
You are absolutely right. What are some common misconceptions about SRHR for people with disabilities?
Many people assume that we don't need health services related to SRHR, which is not true. We have the same rights and needs as everyone else. Ignoring our needs only makes health services less effective and more exclusive.
How can digital platforms help solve problems with access?
Digital platforms can really help if they are made accessible. For example, using captions in videos, sign language, and websites that work with screen readers can help people who are deaf, blind, or have physical disabilities get more SRHR information.
Why do you think family planning is important for everyone, including people with disabilities?
Family planning means having the right to decide when and how many children to have and how to take care of your health, family, and future. People with disabilities deserve to have this choice and the right information to make decisions that are best for them.
Have you ever attended a training on family planning? Was it fine for you?
Yes, I attended one session on health, but it wasn't inclusive. There was no sign language interpreter, and the visuals were hard to understand. It felt like the session wasn't made for me, even though I was sitting there. But there was one training by YPeer, Pakistan, which was totally in sign language, and I loved it.
What changes do you think are needed to make sure SRHR and family planning services are more inclusive?
First, we need accessible health facilities. This means having spaces that everyone can use, having sign language interpreters, and to make sure health workers are trained to understand the needs of people with disabilities.
What role can communities and decision makers play in making these services inclusive?
Communities can raise awareness, and decision makers can ensure policies are inclusive. It's important to involve people with disabilities in designing programs to make sure their needs are fully addressed.
What else can be done?
We need to fight the stigma and misunderstanding surrounding reproductive health for people with disabilities. Public awareness campaigns, better training for healthcare workers, and involving people with disabilities in program design are important steps.
What is the one key message you want the community to remember?
People with disabilities have the same rights as everyone else. We deserve access to health services and information that let us make informed and healthy decisions about our lives. Our needs and voices matter, and it's time we are included in all health-related conversations and services.
Thank you for sharing your insights. This has been a very informative discussion.
Thank you for having me. I hope we can work together to make health services more inclusive for everyone. Thank you.
Thank you so much for watching us. See you in the next episode.